We only have one resolution, and that is a bid for dental equipment for the Health and Human Services building. So can I get a motion to put that on the floor? Member Daly, Member Duncan, thank you. Are you going to take this, Monica?
Sure.
Great.
I don't know unless
we
Scott
can-
would like to share about dental.
We can tag team it, but you're more of a dental expert than I.
Before you is a resolution for $244,337.32 for Benco Dental for the purchase and installation of our dental equipment for the Health and Human Services building. As you see in the background information provided, we did go out to bid on June 5th, and submissions were due on the 19th. We received 4 vendor responses. Benco was not our lowest bid. However, upon reviewing the responses, and we utilized not only our Dr. Bishop, her own dentist, but Dr. Gomez, which is OSF's director of their dental residency program, so an external partner, and then Dr. Davis, who is a Board of Health member and represents the dental position that's required on our Board of Health. They reviewed the various bids and identified 2 areas that did not meet the requirements specified by our bid. The largest being our Panorax machine, CBCT. This is a scanning piece of equipment for scanning that has 3-dimensional capabilities. Patterson provided us the option of one that only had 2D options, so below our ability to actually provide what we were looking for. And then the actual patient chairs, while we had actually identified Belmont as a potential chair for using in this clinic, if you're not familiar with our dental clinic, we provide services to children as well as individuals with disabilities. We have had contracts with Epic as well as with UI Comp, the College of Medicine, and some of their programs. And so one of the concerns was that the chairs be accessible to a variety of population bases. And so Dr. Bishop, reaching out to techs that service dental equipment, they recommended that the chair doesn't actually have the mechanics that would make it usable for our various clients. So we are actually recommending Benco, which came in as our second lowest bid.
Does this equipment have to be installed prior to occupancy?
It does. And so in terms of our timeline, this is our medical equipment as well as our community kitchen. All of this will be scheduled for delivery in around October, the first 2 weeks of October, and then is allowed to be put in before occupancy permitting and tested.
Which is why it's coming before us with a special meeting, so that we can get it and it's installed before we get occupancy of the building. Any other questions? Yes, member here.
In the background information, it just mentions that it came in under bid, or what someone assuming what was expected. What was the expected amount that was in the whole HHS amount?
So I believe in our HHS budget, we put a line item for up to $600,000 for this specifically. And again, that was not necessarily recognizing the considerable cost savings that we would get from open bid, but also for those that have like government procurement contracts as well.
Thank you.
And this isn't part of the GMP. This is in addition to. Any other questions? Okay, all those in favor, please state aye. Aye. Opposed? All right, thank you. Oh, there we go. Anybody here for public comment? Miscellaneous? Okay, we're adjourned.